Training Module 2 Documentation and Record Keeping for Caregivers. Taking notes and keeping records are very important for caregivers. It helps them give good care and communicate well with others. When caregivers write down what they do and see, it helps them remember and share important information about the people they care for. This is important for keeping people safe and making sure they get the right care. Purpose of effective documentation. 1. Communication. Documentation facilitates communication among caregivers, healthcare professionals, and other stakeholders involved in the care of individuals. It ensures that everyone is informed about the individual's needs, preferences, and treatment plans. 2. Continuity of care. Accurate and thorough documentation helps maintain continuity of care, especially in settings where multiple caregivers are involved. It provides a clear record of the individual's medical history, medications, and care requirements. 3. Legal and ethical considerations. Documentation plays a vital role in meeting legal and ethical obligations. It serves as evidence of the care provided and protects both caregivers and individuals in case of legal disputes or audits. 4. Quality of care. Effective documentation contributes to the overall quality of care by enabling caregivers to track the individual's progress, identify trends or changes in their condition, and evaluate the effectiveness of interventions. Type of records. A. Medical records. These include information about diagnoses, treatments, medications, and healthcare provider interactions. B. Behavioral records. These document observations of the individual's behavior, mood, and emotional well-being. C. Daily care logs. These capture routine activities such as meals, hygiene, medications, and appointments. Confidentiality and privacy. Caregivers must keep people's information private and safe. They must follow rules like HIPAA, which helps protect people's privacy in healthcare. Caregivers need to be careful about who sees the records and how they are stored and shared. Key components of effective documentation. When caregivers write down information, they need to make sure they include the most important details. Here are some things they should always remember to include. A. Medical details. This means writing down anything related to a person's health, like if they have any medical conditions, what medications they take, and if they've had any surgeries or treatments. B. Behaviors. Caregivers should write down how a person acts and behaves. This includes things like their mood, how they sleep, if they eat well, and if they have any pain or discomfort. C. Daily activities. It's important to write down what a person does every day. This includes things like when they eat, when they go to the bathroom, if they take any walks, and if they have any activities they enjoy. D. Changes in health. If anything changes in a person's health or how they're feeling, caregivers need to write it down. This could be things like if they start feeling sick, if they have trouble moving, or if they seem more tired than usual. E. Responses to treatment. Caregivers should write down how a person responds to any treatments or medications they receive. This helps doctors and nurses know if the treatment is working or if they need to make any changes. In conclusion, effective documentation and record keeping are vital components of providing high-quality care as a caregiver. By diligently documenting medical details, behaviors, daily activities, changes in health, and responses to treatment, caregivers ensure clear communication, continuity of care, and compliance with legal and ethical standards. Upholding confidentiality and privacy regulations, such as HIPAA, is essential to safeguarding individuals' personal information. By adhering to these principles and incorporating key components of effective documentation, caregivers can enhance the safety, well-being, and overall quality of life for those under their care.